welcome to the 4th episode of Hybrid Healing Hour, Weight Loss. I think this is one of my favorite topics, and it's definitely a trending topic today.
And probably the thing that we get asked the most about in our practice. We have a lot of patients come to us, and no matter what they're coming in for, at some point they're going to talk about weight as well.
Absolutely. I think starting out, one of the biggest things I always talk to my patients about with losing weight is this is a marathon, not a sprint. You have to have a long-term weight loss plan. This is all about, a long-term commitment.
And for many years, doctors used to tell their patients, it's all calories in versus calories out. That's not really true. You can decrease your caloric intake, and yes, you may lose some weight, but there's more factors involved as well. It's not just the calories that are causing you to gain weight. Almost every diet, including the craziest diets, can lead to weight loss, and they probably will all work in their way, but the question is, are they sustainable? Will you actually maintain the weight that you lost, and are they healthy?
So talking about the calories, one of the things I love about what we do in our office is actually looking at a body composition and determining the amount of fat somebody has and muscle mass rather than just looking at the scale. The scale is known to lie. You can actually gain weight on your weight loss journey, and it doesn't mean you are gaining fat. You could be gaining muscle. And the other thing that our body composition does is it looks at the BMR, which is the basal metabolic rate. And that tells us how many calories somebody is burning while they're at rest. So I always say the example of, this is how many calories you're burning while you're sitting on the couch doing nothing. So when you exercise on top of that, or if you're eating the right foods that help stimulate your appetite, and the more muscle you build, that goes up. And so that's another, factor that plays into the role of it's not just calories in and calories out.
So before you start on your journey to lose weight, you need to ask yourself, are you truly ready to make the changes, the permanent changes that you're going to require versus in regards to diet and in regards to lifestyle?
Yeah, I think there's several questions we need to review that people need to ask themselves before they start that journey. Exactly. And one of them is, are you motivated to lose weight?
Yes. And are you too distracted by other pressures?
Do you use food as a coping means?
Are you ready to learn strategies that could help limit your stress?
Do you need other support, such as a community or help from friends or professionals or somebody that you can talk to help you manage your stress?
Are you willing to change your eating habits?
Are you willing to change your activity habits?
And do you have the time that it takes to make these changes?
I think a lot of people don't realize that an option is seeking medical help for these changes as well. And that's where you can count on your medical provider to discuss that.
And medical help should always be an adjunct to everything else. It can't be one without the other.
Right. Such as, is it now time to incorporate medication into my weight loss journey? That's something that I think you should have professional help with that.
Exactly. And part of the journey is that you need to set realistic goals. If you say, I'm going to lose 60 pounds in the next 2 months, that's not realistic. It's not going to happen, and you're destined to fail and be frustrated.
It's not healthy. Let's just say that.
That too.
And so talking about healthy, it's going back to the diet. It's not just a diet. I think everybody needs to choose healthy foods. And I'm a big proponent of eating clean. And it's, we're going to get later into the topic of when to eat and what to eat, but eating healthy foods in general, everybody knows what they need to eat. It's a matter of doing it, having the willpower, and implementing it.
Exactly. And along with that, you need to stay physically active.
Hydration is key. Drinking water, tons of water to help. We usually use a calculation. I like to use the calculation of half your body weight in ounces. So if you weigh 180 pounds, you need to aim for about 90 ounces of water a day.
It's a good rule of thumb. High fiber. Most people are not getting enough fiber in their diet. If you're eating a lot of fast food, junk food, high carb food. That's low fiber.
And fiber not only helps everything on the cellular level, it helps with your gut, your bowel movements, and it also helps kind of sustain your hunger.
And something else is optimizing hormones. We're big on that in our practice, but I think many people ignore that as part of their weight loss journey. It's not just diet. It's not just exercise. It's your hormones. Your hormones control everything. The key hormones with weight loss are cortisol, insulin. There's so many that are involved in that process.
Also, another factor is just optimizing your nutrients. Big key role is vitamin D, your chromium, your magnesium. Even alpha lipoic acid has been shown to show some data for weight management.
So what are some of the tools that we can use for weight loss? Fasting has become very popular these days, and for a reason. I tell patients that there's not one religion on the planet that does not have fasting built into it somewhere. And the reason for that is because we've known for thousands and thousands of years that fasting is beneficial for many things. And if you look back the way human beings were designed, we were designed to be hunter-gatherers, right? We did not eat 3 meals a day because we weren't getting 3 meals a day. We were spending most of our day physically active looking for food. And when we finally got enough, we sat down and ate it. So
You mean they didn't have a refrigerator that you could go open the door and stare and figure out what you want to eat late at night?
not like we do now. And now our lives are very easy. We are not dying of starvation anymore. Now it's the exact opposite. We're dying of being overfed.
Yep.
Right? So when you eat is as important as what you eat. And that's something that you have to remember, that you can't eat all day long.
Right. When you fast, or when you're not in a feeding state, it allows your body to actually increase its natural GLP-1 that is released, which is during the fasting state. And think of this as also it inhibits, you can finally turn off your insulin. If you keep eating, your body, your pancreas is going to continue to pump out insulin to help get the glucose into your cells. And I think this is what is leading to insulin resistance and inflammation in the body. And so by finally stopping eating for a period of time allows your body to rest, finally.
And for those who don't know, GLP-1 is what Ozempic is, right? So you're basically, your body is making Ozempic. It's giving it to you for free. You just have to take advantage of it. So
the way I look at fasting is that what I don't like to eat, or what I recommend for our patients, is don't eat within an hour of waking up in the morning. Whatever time you do wake up, and if you can make it longer than an hour, that's even better. And then what I also recommend is not to eat 2 to 3 hours prior to bed. So, we are big proponents, and we even have a handout that we give a lot of our patients on our time-restricted feeding protocol. And so I recommend to always pick a 6 or 8 hour window. You're a big proponent of the 6 hour. I personally am an 8 hour. And with that being said, I think going back to the whole history of the human, when we were hunters and gatherers, they did that during the daylight. And so it's best, I think, to pick a daytime window of a 6 or 8 hour window. And so if you wake up at 6 a.m., don't eat until 7 a.m. at least. I would recommend to go longer. And then whenever you put that first bite of food or calorie into your mouth, or anything with cholesterol, that's immediately taking you out of fasting. And then you count 8 hours. And that's to the point where you need to be done putting anything in your mouth.
And that's anything with calories, because a lot of people will have their cup of coffee in the morning.
But they put cream and sugar in their coffee. So the other safe things you can do, I've been told before, and I'm not sure if this is 100% accurate, but it's a good rule of thumb, is anything over 40 calories will take you out of the fasting state. Anything with sugar will take you out of fasting state. So, I read all of my labels. And a lot of the things I do, I'll work out in the morning, and I can still do my BCAAs in the morning, and they are made with monk fruit or stevia. So they have 10 calories, but no sugar. So that is not taking me out of my fasting state. And then, I don't eat until 1 o'clock when we eat for lunch. And then I'm usually done eating dinner by 7:30, 8 p.m. at the latest. And that means I do not do anything past 8 p.m. except for water.
Yep. And remember, true fasting doesn't start when you put the last bite of food in your mouth. That food is going into your stomach and it's staying there for a while. So you are still being fed. You're just not eating it. Now, one of the things that that you should remember is that fasting windows and eating windows are usually overestimated by people. So what I tell people is if you're going for a 6-hour eating window, then actually calculate a 5-hour eating window and you probably will hit 6 hours. So just add an extra hour to whatever you're doing. Fasting is not just for weight loss. Fasting has so many benefits. Fasting has been shown to help with longevity. It's been shown to help with something called autophagy. Do you want to explain autophagy?
Autophagy is the process which your body will gobble up all the dead tissue and the dead cells. I mean, our cells are constantly dying and regenerating. And so when you have these old cells in your body, they don't always leave appropriately, and they can sometimes become a zombie cell, and then that can lead to the bad things like cancer or inflammation. And so autophagy helps speed up all the tissues to be excreted.
And what I tell patients is that when your body is looking for food, it's going to go for those dead and dying cells first and cannibalize them for food. Then when your body's eating again, it's going to replenish them with new healthy cells. So it's a good way to clean up your system. It's also a good way to reduce inflammation in your body.
And with that, I mean, it's been shown and linked with longevity, with longer living lives.
And it helps reset our hormones. So on top of diet and exercise and fasting, we can add medications. There's plenty of medications out there. The problem with medications is a lot of the newer ones can be very expensive. Insurances may cover medicines for obesity and being overweight if you have obesity coverage or weight loss coverage on your insurance plan, and most people don't. So for most people, the newer medicines are going to be expensive. Some of the older medicines that have been out for a long time are ones like phentermine.
Yeah, so phentermine, it's been shown to block the brain's hunger signals, and it increases the release of the catecholamines, which is made by the adrenal glands, which is your dopamine, your epinephrine, your norepinephrine, which are your mood hormones. And so this also has been linked to, it mimics the structure of phentermine is very chemically similar to amphetamines, which are used for ADD or also known as stimulants, right? So they speed you up. So one of the possible side effects of this is an increased heart rate, some elevated blood pressure. Sometimes if people tend to be an anxious person, they can notice that they're a little more anxious than usual. Now, a question I get asked a lot with this type of medication is, oh my gosh, is this related to fen-phen? And the answer to that is no. Fen-phen was taken off the market in September of 1997 because the first part of the the phenylphloramine was associated with valvular disease in the heart and pulmonary hypertension. So fen-phen was phenylphloramine and phentermine, but phentermine has still been continued by itself, and it is an effective weight loss medication. It definitely suppresses your appetite, can speed you up, help you focus, and stay driven. So you can lose about 5 to 10% body fat with that.
So another medicine that's out there is orlistat. It used to be under the prescription Xenical, and then it was released over the counter as Ally. So orlistat is well known more for the side effects that come along with it than the actual efficacy. It does work. It blocks lipase, which is a digestive enzyme. By blocking lipase, you're blocking about 30% of the fat that you eat. So what happens to that fat? It gets turned into an emulsion, kind of like oil. It looks like an oily yellow substance that goes through the GI tract. And the side effect tends to be leaking of this yellow, oily substance, soiling clothes. It can cause diarrhea. It can cause excessive gas and bloating. There's a lot of side effects, but it is effective. Typically, you can lose 5 to 10% of body weight using orlistat. Now, the problem is that it only works on fat. And we know that fat is not the only problem out there. It's carbohydrates. There's so many other things involved. So people who have worse symptoms are the ones that are eating the higher fat diet. So we use that medication in conjunction with a low fat diet to minimize the side effects.
I definitely would not eat fat if I knew that was a side effect. Another medication is Topamax, or generic name topiramate. Now, that one I've used in the past because it can help also decrease your appetite in the form of helping you stay full longer after you eat. This medication is also put in with phentermine. There's a brand name called Qsymia or Qsymia, and it's pretty effective. You can lose up to 9% body fat. Or body weight, I shall say. A lot of the studies were done with a scale. So one of the things I clinically see this work well is with more that addicted behavior. It can help definitely with the sugar cravings. I've noticed that. I had somebody lose about 10 pounds in 1 month because every time she went to go drink a soda, it made it taste like she was chewing on pennies. And she was like, this is disgusting. So she quit eating anything with sugar or sugar alternative taste. Anything sweet, she stopped. So I found that effective. Unfortunately, I don't get that benefit with everybody. So
another medicine that's been around a long time for diabetes, but also we show that it does have some mild weight loss effects, is metformin. So metformin works to help your body with insulin sensitivity. You get mild weight loss, maybe 5 or 6 pounds, but in one study, up to 10% of body weight. Metformin also has a lot of anti-aging benefits, and people are using it in anti-aging medicine. And right now, it's relatively inexpensive.
So the big, newer brands or types of medications out there are the GLP-1s. Why don't you tell us about those? I'm pretty sure everybody is interested.
Yep. So GLP-1s, most people know them as Ozempic, Wegovy. They're a class of medicines that have been out for a little while now. And we were using them a lot for diabetes, but we found that when we use it for diabetes, patients were losing weight. These medicines work on several different organ systems. They're not just working on one part. So they'll work on the pancreas. They help increase insulin production and decrease glucagon in the pancreas. They work on the stomach. They decrease gastric emptying, which means they slow down the passage of food from the stomach into the rest of the GI tract, so you feel full faster. And in turn, it decreases your hunger. They can work directly on the brain in decreasing hunger. They do have side effects. There's some side effects that come along with the delayed gastric emptying, such as nausea and vomiting. In fact, that's the biggest one that we tend to see. So we try to go very, very low and slow on the dose and build up until people can tolerate the higher doses. They can cause other GI effects like constipation or diarrhea.
Heartburn is a big one I've seen too, along with the whole nausea and vomiting.
And we've had a few patients in our practice that have also experienced depression and anxiety that they had never had before until starting these medications. So the first one that really came to market strictly for weight loss, we're not talking about for diabetes, is liraglutide. That was released under the name Victoza for diabetes and Saxenda for weight loss. That one had reflux as a big side effect. That is a daily injection. People, the needle is tiny. You usually don't feel the needle. It's really small. I
think one of the things that trigger people to have some of these side effects as well is not understanding their portion control. When you have this medicine going into your system that is supposed to help keep the food in your stomach longer and make you feel full faster, if you eat very fast, you're going to continue to override this trigger, this signal of your brain telling your stomach telling your brain that you're full. So I think when people overeat is when they feel the worst. So I always recommend for people when they're doing this type of medication to start like significantly. The moment you do that shot, that day, I want you to get a little saucer and eat off of that, not a big plate. So when you start eating with a small portion right off the bat, you won't notice that you're trying to eat your entire plate. And I've seen grown men who eat 2 burgers go down to eating a half a burger. So I would say start with a half a burger, and then it's best, there's things that people have been taught during like Weight Watchers and all these little tools of how to slow down. And part of that is chew your food. Just chew your food, swallow, drink some water in between, put your fork down in between your bites.
And stop eating when you're full.
Exactly. There's actually I think it was I can't remember if it was a podcast I was listening to, but I heard a tip that they said the 80% rule. So some people follow this, and I think it was a country in Asia, somewhere like Japan, maybe, that they do that when they feel 80% full, they stop eating. So I thought that was really interesting.
It's a good rule of thumb. And I've also read that about eating on smaller plates. You feel full faster. It's a visual cue. So after liraglutide came semaglutide. Now that's the one that's talked about a lot. Ozempic, which is for diabetes, or Wegovy, which is for weight loss. Again, it's a very expensive medicine. It's a once-a-week injection, which is much better tolerated, but at the same time, if you're going to have a side effect, it's going to last for a lot longer. It's going to last for a week, maybe even a little bit longer. So you really want to start slow on these medications and build up the dose very, very gradually. It's shown that you can get about 10 to 20% of body weight loss with using these medications.
And I know Rybelsus is the oral form that is strictly FDA approved for diabetes, but it does have its own weight loss benefit as well. I don't see the 10 to 20% weight loss with Rybelsus quite as much because the equivalency does not get you to the maximum dose of the shot form, the injectable form. So you're limited on the dosing of Rybelsus.
Yeah, and it's very important with Rybelsus, that has to be taken in a specific way. So it's absorbed.
First thing in the morning, empty stomach. And then that also, because it is orally, sometimes the nausea, I've had people say they feel more nauseous with that one. But usually they subside with eating a little something within 30 minutes. So for people who are fasting, I usually recommend that they take it 30 minutes before their first meal rather than just first thing in the morning. And then that way they don't have to worry about breaking their fast until they're ready.
So semaglutide was huge, and we're thinking, wow, can't get better than this.
It's an amazing miracle drug.
And then all of a sudden, Tirzepatide came out. So Tirzepatide is released under the brand name Mounjaro. As of right now, it is still strictly for diabetes. So it's not does not have a prescription indication for weight loss, but it is being used for weight loss and actually gives significantly more weight loss than the semaglutide, but it's also a little more expensive than semaglutide. It's a combination drug. It's a GLP-1 plus a GIP, so you get a dual action. And one of the things that you have to remember with these medicines, they all have nausea as a side effect. It has a little bit less nausea as a side effect than the semaglutide, but this medication can actually make birth control pills less effective. So if you're on this medicine and you're on oral birth control pills, you should be talking to your doctor about getting on a different form of birth control because there is still a chance of pregnancy. And in this one, you can lose quite a bit of body weight, 20% up to 30% even.
And I know with the studies that they have done, it showed even at a lower dose of like 5 milligrams, weight loss was continuing over a 6-month period of time, nice and gradual. So it's one of those things that I don't believe you technically need to go up immediately on the dose unless you're a diabetic. Yeah, obviously, you need to manage your A1C appropriately.
So one of the questions that people always ask is, if I go on this medicine, do I have to be on it for the rest of my life? Do I have to stay on this? What do you tell your patients?
No. But I would definitely taper slowly off of it. And I think my idea of weight loss is getting you to a healthy point. So one of the things we do is, like we already said, is the InBody in our office. It's a body fat composition analysis. And I want to see people get to a goal, not a goal weight on the scale. Some people want that, and it's hard to break them of that habit. It's a mental that just cannot get their mind wrapped around the fact that I don't care about the scale. But I want to see their visceral fat go down. And visceral fat is the dangerous fat that leads to heart disease and diabetes. And these medications have been shown to reduce the visceral fat, which I find amazing.
You brought up something else too. Another negative side effect of these medicines is although you lose fat, you also can lose lean muscle. And when you lose lean muscle, you're not healthy.
You're becoming skinny fat,
Exactly.
sarcopenic.
So you have to change your lifestyle. You have to use these medicines as a tool to get to where you want to be, and then you have to find the tools you need to maintain that. Our goal is always to get our patients off of medicines. We don't want people on medicines for the rest of their lives. There's no reason for that. These are all things that will help you get to that goal. And now there's newer and better medicines on the horizon. These medicines are going to be old-fashioned very soon. We know that there's clinical trials going on medications that have even more significant weight loss. So what else is out there other than prescription medications? There's also compounded semaglutide and tirzepatide, and many people out there are using the compounded forms. Compounded forms, are they the same? No, they're a little different. They are essentially the same active molecule. We use them in our practice. They're very effective. And the nice thing is they tend to be less expensive. So it's more affordable for people. I would say on the average for compounded semaglutide, for the lowest dose, people are paying about $200 a month. And for the higher doses, up to $500 a month for the highest doses. Now you have to remember, when you're getting a compounded medication from a practice, don't go by how much you're paying a month. Go by what dose you're getting for how much you're paying a month. So if you're on a low dose, you should not be paying as much as other people are paying for the higher doses. Other than compounded medications, we also have peptides out there. So there's plenty of peptides, right?
Yes, there's pretty much a peptide for almost anything these days, but a few of the peptides we've been using for weight loss in our office is the AOD 9604, or people just call it AOD. This has been shown to reduce body fat and regulate your fat metabolism. It also inhibits the lipogenesis and stimulates lipolysis. What this is the breakdown or the growth of lipids, but that is done in your fat cells, and therefore it can increase the metabolism of, or I guess you should say, using the fat cells for energy. So that's how it doesn't get rid of fat cells, put it that way. But that's a great one. It's oral or injectable. There's Relora. Now this is good for, I find, a lot of people who like to stress eat. So this one helps regulate your stress, and especially the stress eating, and it's just derived from magnolia bark. So I like the natural option of that. Another one, a big one that we do, and there's many, many benefits to it, but we'll touch just on the weight management side of it, is growth hormone releasing hormone. So an example of this would be your CJC ipamorelin. There's many other ones out there, sermorelin, tesamorelin, but this is where the CJC is stimulated. It stimulates the pituitary gland in the brain to make your growth hormone. So it is not a growth hormone. There are other, growth hormones out there, but this helps your body make its own growth hormone. And the ipamorelin is what mimics ghrelin, and it binds to the ghrelin receptor in the pituitary as well. So this has profound lipolytic benefits as well.
So these are also good that not only decreasing fat mass, but increasing lean mass. So you're getting a better benefit than you do with some of the GLP-1s. And it's a great tool to use along with a GLP-1.
Exactly. You can get about we call this the 5% lean mass, lean loss, because it actually can give you more muscle growth.
The only thing is it does not affect your appetite.
Right. Another one is the 5-amino-1-MQ. Now this blocks the NMT, which is what stimulates the metabolism. So I'm not real familiar with this one as much, but it definitely makes your body utilize the excessive fat stores.
It's been shown to shrink fat cells, essentially.
Right.
So then people ask, is there anything I can do that is not medication? And so we explored that, right? And we did look at everything out there that was available to help build muscle and lose fat. And what did we find?
We found the EmSculpt Neo. And this is not to be confused with the CoolSculpt.
Or any other devices that try to pass themselves off as the EmSculpt Neo. You have to be careful. If you're looking for EmSculpt Neo, there's plenty of advertisement out there where people claim they have it, but if you don't see actual EmSculpt Neo on the machine, it's fake, and it's also not FDA approved to do the things that they say it can do.
So the EmSculpt Neo, as we discussed, this actually can get rid, kill, destroy your fat cells. So unlike many other things, we're born with a certain amount of fat cells in our body. And when you gain weight or when you are getting fat, your fat cells actually expand. And when you lose weight or lose fat, your fat cells are shrinking. So you don't get more fat cells. So this can actually kill up to 30% of those fat cells with radio frequency. And then there's the high FEM part of this, which is a high intensity focused electromagnetic energy. And that is the part that's stimulating the muscle contractions. And what this does is actually allows your muscles to contract in 6 different ways, which I find amazing. When you're working out, you're using about 3 different contractions. So not only does this kill the fat cells, it is building muscle. You're actually getting new bands and hypertrophy.
And one treatment to the abdomen is equal to
20,000 crunches.
That's a lot of crunches. The nice part is it's completely painless. It's actually less painless than working out, because when you work out, you build up lactic acid, which is what causes the pain, right? And these devices have a built-in mechanism that helps eliminate the lactic acid, so you don't get the pain the next day or 2 days later.
Yeah. If you put it on your legs, on your thighs, and it's as if you're doing 20,000 squats, you don't feel sore when you're going to the bathroom the next day or going upstairs.
So like we've talked about, we have plenty of tools out there now available, and we're at a time where weight loss is getting easier, but it's still a challenge. It's still a lot of work. You're going to have to put in most of the work. We have tools that will help you with the work.
As you said, it is getting easier, but I would still always recommend for health benefits, we want you to be healthy. We don't want you to just get skinny. And that does mean you have to put in the work. You need to work out. You need to eat healthy.
And we need to get insurance companies to change their perspective and look at obesity and being overweight as a medical condition, not a cosmetic condition. So we hope that some of this advice helps you.
And stay tuned for further podcasts as we'll go into a little bit more of these in more detail.